In this video, we're going to go over everybody's favorite technique, which is foam rolling the IT band. Now, I say that because it's probably the most painful area to foam roll when you're doing it effectively. Now, the IT band itself is a very inflexible structure, but what will happen is the quadricep muscles and the hamstring muscles that are adjacent to the IT band will get really tight and sore, and so we want to try to break down those tissues, loosen those up to take pressure off the IT band and those attachments down to the knee. So we find this very useful for patients who are suffering from IT band syndrome or just a lot of quad tightness, which is causing some knee pain. So what this looks like is you're going to start the foam roller actually on the back side of the leg behind the knee here, and then you're going to prop yourself up, bring this leg forward, so this is going to give you a good balance point here. So now to start you want to just let your weight sink in on this back side of the leg here, and then you're going to rotate into that outer quadricep muscle and IT band junction. So you're going to get there, hold that, and it should feel fairly sore and uncomfortable if this is a tight spot on you. And then from here, you're going to slowly just bring yourself down. Now, as you're going down, you should feel a bit of a ridge, and that's the border of the outer quad. And just try to stay right on that spot and really just relax and just try to keep dead weight behind it so we can allow those muscle fibers to start loosening up and breaking down. So as you're going up the leg here, wherever there's a lot of tightness and soreness, try to stop and just let your body relax into it. Hold it for about 30 seconds and then continue up the muscle. And you'll keep going till you get up to the side of the hip here. You'll feel a little bit of a bone, and that's about as far up as you need to go. Now, foam roller is usually very effective for this, but there's other techniques using a lacrosse ball or an adult league softball, where you can then go back and do some real focal spots of tightness along that outer ridge of the quad and IT band area. So what this will look like is using a lacrosse ball here. So let's say this area was where you felt a lot of that tension. So what you're going to do, just put the ball right there, start more on the back side again, get your weight just behind the ball here, and then from here rotate into that spot and just hold it. Don't need to roll at all. It's going to be very painful if you do so, and you just want to, again, relax. You don't want to be tense the whole time. Try to get as much of that tension to release from the muscle as possible. So you'll hold it for about 30 seconds, and then instead of rolling to the next spot, just reach down, bring it up, set it into that next spot that was really tight, and then roll into it again and just hold it. Sometimes the lacrosse ball is a little too small, so you'll want to use an adult league softball. This is not an adult league softball, but it's about the same size. And you'll do the same type of thing that we did with the lacrosse ball. Start on the back, rotate into the front, staying relaxed, pushing down into it, keeping your body weight nice and relaxed over the ball. And you'll do that wherever you feel that tension there. So again, you want to do some of this technique every single day for a few minutes, working along the entire muscle going up from the knee all the way up to the hip. Do a little bit every single day versus trying to do just one day a week of just 30 minutes of just really hammering out that tissue, because you'll just be excessively sore, it'll be excessively painful. So a little bit each day, along with myofascial release inside the clinic here, you'll see a lot of improvement in the tension of the muscle and a lot of improvement in the conditions you're coming in to see us for.